Senator Marshall.
Yep. Well, thank you, Madam Chair, and let me start by congratulating you and my ranking member, Senator Burr, as well. When people ask me why you joined Congress, why you came to Senate, this would be one of the issues that I said, well, this is why I came here, that I've lived this for the last 30 years of my life and now had an opportunity to make things better. And people ask me all the time, does anything get done in Congress? Is there any bipartisanship opportunities out here? And I reach across the aisle and say thank you to all my colleagues across the aisle for your work and your help on something that's so important. I think back to my career, and in residency program, we delivered 5,000 babies a year. So 4 years of residency, 20,000 babies. We never lost a mom. In my private practice, another 5,000 babies, and we never lost a mom. So I was shocked when I came to Congress and said, my gosh, the United States has the highest maternal mortality rate in developed nations. And I brag about our record, but I humbly just tell you I had great nurses. I had great doctors around me, great anesthesiologists and anesthesia and pediatricians, and it was this team. And I just can't say enough about nurses, and a couple of times it was just prayer that got a couple of my moms that kept them from dying as well. So I sit here and look, well, what's different today? We kind of started this progress on the House side 4 years ago to see, well, what are the causes? And we passed legislation, the Preventing Maternal Deaths Act, just to study, well, let's find out, well, why are people dying? What's causing it? And to no surprise, we came up with the typical causes of maternal mortality: hemorrhage, maybe cardiovascular complications, coronary conditions, preeclampsia, embolic phenomena, pulmonary embolus, right, and an infection. And I asked myself, so what's different today than 10 years ago and 20 years ago? And there's two underlying issues we've identified through those studies, and we're trying to address, and we've got more work to do. The two underlying connect the dots causing these problems are access to care and obesity. Again, I think back to my residency program. We showed up there, and half of the patients weren't getting prenatal care. And those were the moms that had complications. So if you have preeclampsia and don't recognize it, it turns into eclampsia, which is a seizure that occurs like lightning, and that's when the strokes and women died. So we set up a prenatal clinic. We found a church partner, and on Saturday morning, the residents would come and do an extra clinic to make sure these moms had access to care. So at the end of the day, whatever we do to make sure that these moms have access to care, to prenatal care, is a solution. The other big difference I see is obesity, and I think Senator Burr kind of talked about it, that the average weight of the mom starting her prenatal care in my practice my last several years was literally 30 pounds more than it was 20 years before that. And because of that, the incidence of pregnancy-related diabetes, type 2 diabetes, was much higher. So just to be frank, if you have a woman with preeclampsia, obesity makes her harder to take care of. If a woman is hemorrhaging and she's obese, it's harder to save her life. So that access to care and the obesity are the two take-home lessons from all this. And again, I think we're starting to address them. I think we're getting there, but again, there's just more and more work to do. So I'm very proud of what we've done. I'm very proud to be co-leading the Maternal Health Quality Improvement Act. I think it's several steps in the right direction. Continue to work with the Center for Medicare and Medicaid Innovation. I think that there's innovation opportunities out there. How do we get that prenatal care delivered in the first trimester? We have to get those moms, those diabetic moms, taken care of in the first trimester. Otherwise, they're going to deliver 12-pound babies. And when you're delivering a 12-pound baby to a mom, she's going to have huge increased risk of hemorrhaging and infection and a risk of a C-section. And if you're tripling your C-section rate, that's what leads to maternal mortality. It's an anesthesia complications. They're the ones that are going to get the deep venous thrombosis and lead to a pulmonary embolus. So getting these people in some type of innovation programs, I think there's opportunities for telemedicine as well. And obviously, this is something very deep and personal to me. So I'll just close by saying congratulations again. Thank you for your leadership. But this is just the start, not the end, and we'll keep working in this committee to help bring lower mortality for women across the United States. Thank you. I yield back.
Thank you, Senator Marshall. Thank you for your expertise on this. We appreciate it.